The things we're going to talk about today are what you'll need to bring to the hospital, what you're going to expect while you're here at the hospital, and the rules for the first 2 weeks following your surgery while you're recuperating at home. Please keep in mind that all of the instructions that I'm giving you at this time are general, and if you have any special circumstances or considerations that need to be brought to your surgeon's attention, you'll need to discuss that with him after this video. You will not need to bring any other equipment that you may have been gathering or getting in preparation for the surgery. You will use our canes, our walkers, our dressing equipment while you're staying in the hospital. Please leave yours at home. If you need to have your walker or cane to get into the hospital, certainly use it, but then have your family or friends take it back to the car so that it doesn't get lost during your surgical time. As far as clothes go, whatever undergarments you would normally wear to be comfortable, bring those. We do prefer that you wear loose-fitting clothing. Elastic waistbands are generally more comfortable. You will probably put on at least 10 pounds, sometimes more, of fluid weight throughout the process of the surgery. The weight will come back off, but your clothes will be tight in the meantime. So loose-fitting clothing, elastic waistbands are best. For your top half, anything that you're comfortable in will be fine. Short sleeves, long sleeves. Some people prefer to bring both because you may find you're a little bit cold until you get started moving in your therapies, and then you need to take some layers off. We do also want you to have regular shoes to wear, something with a nice non-skid sole, and preferably something that goes around the back of your heel so you're not shuffling along trying to keep your feet shoved into your shoe. That's pretty much it as far as clothing goes. You may also want to bring some of your own toiletries. We certainly have toiletries here at the hospital for you to use, but if there's something in particular that you prefer to have, you can bring that with you. Now, you'll call the hospital the day before your surgery, and they'll tell you what time you need to arrive and also give you directions as to where you need to go. Following your surgery, you'll be transferred to the 4th floor at the Liberty Street facility, and once you're up on the 4th floor, nursing will assist you with bathing and also your medications. The doctors and surgeons will come in to see you, and physical therapy may or may not see you that first day of your surgery. Depends on what time you're done with your surgery and how you're doing. The day after your surgery, physical therapy will be coming into the room to help you do some stretching and go for a short walk. Occupational therapy will also be coming into your room, will help you with getting dressed and get your knee immobilizer on in preparation for your transfer to the Grove Street facility. When you're transferred to Grove Street, you'll come to the 3rd floor to the rehabilitation unit. And once you're there, the nurses again will assist you with bathing and also with giving you your medications. And physical therapy will see you that first day at Grove Street here in the afternoon. The next morning, occupational therapy will come in again to assist you with getting dressed. We'll show you how to use the adaptive equipment for getting yourself dressed independently, so you'll be able to do that at home. We'll also work on getting in and out of the bed using the cane as a leg lifter and talk to you more about correct positioning while you're recuperating. Social work will see you as well at Grove Street facility, and they will help you to get any of the equipment that you might need to get for the time that you're recuperating as well. The doctor and the surgeon will also see you at Grove Street as they did at Liberty Street. You will be getting 2 sessions of physical therapy a day and 2 sessions of occupational therapy a day while you're staying at the Grove Street facility. Physical therapy will assist you again with walking with the walker. They'll make sure that you're able to navigate on the stairs safely, make sure you're able to get in and out of the bed safely, and they will be working on your stretches. Occupational therapy, again, will show you how to get dressed. We'll show you how to get in and out of the bathtub or the shower safely. Make sure that you're able to get up and down from the chair, from the toilet, from the bed, and make sure that you're able to get in and out of the car safely. I would also recommend, if it is at all possible, for a family member or a friend or somebody that's going to be assisting with your care upon your discharge to come to your therapy sessions, that they do so. You will find that you're going to be medicated for your pain control, and it's nice to have a second set of ears there, especially if it's somebody who's going to be assisting you when you're home, so that they know as well as you know what you're to be doing after your discharge from the hospital. If it is not possible for them to do that, if they could at least, when they come in for the nurse's discharge, let one of the therapists know, and we can certainly come and see them at that time. Often people do leave that second day after surgery. However, if you're not feeling well, if you're not moving well, if for some reason we do not think that will be safe, you will not be going home that day. We will not send you home until we're sure that you're safe to go home. So you may want to pack an extra couple of pairs of clothes just in case your stay ends up being a little bit longer than you anticipated. For the first 2 weeks following your surgery, you'll need to use a walker every single time you get up. We do want you using what we call a standard walker, which means there are no wheels on this thing. If the walker you have at home, the one you've borrowed or the one you've gotten from anywhere has wheels on it, please let us know so we can get the standard legs for you or assess how you're moving with a wheeled walker to determine if that would be safe or not. You will use the walker every single time you walk until the doctor tells you otherwise. Also, during the first 2 weeks, once you leave this facility, we ask that you stay indoors until your 2-week follow-up visit. We want you to limit the amount of time that you're up to no more than 20 minutes at a time, getting up for your meals, for toileting, and to take a shower or sponge bathe once a day. During this first 2 weeks that you're home, during the day when you're not up for one of those purposes of eating, toileting, or bathing, you will be laying down in such a way that your leg is elevated above the level of your heart. Now, to do this, you can use just a stack of pillows. Truly, when you're home, you'll probably need quite a stack of pillows because they tend to sink under the weight of your leg throughout the course of the day. So if I put at least 2 pillows here, if I'm laying down flat, that's good enough. All right. When you're laying during the day, have your leg elevated above the level of your heart. At night, you won't need those pillows, and you are allowed to sleep in any position that you're comfortable sleeping in. Generally speaking, you will be more comfortable if you're laying on your side to have a pillow in between your legs then, just to keep your hips in good alignment for your comfort. We do want you using a cane as a leg lifter, getting in and out of the bed until the doctor tells you otherwise. To use the cane as a leg lifter, you're going to hook the handle of the cane into the arch of your foot. Keep your knee locked straight to give you better leverage with your arms, and you can just swing that leg right out of the bed. Do not bring your own equipment with you to the hospital. We will have all the equipment that you need available in your room for your use. If you need to order any of this equipment, we can make sure that that gets done for you before you leave here. The other equipment that will be available in your room would be the equipment used for getting dressed. That includes the reacher, which is used to get your shoes and socks off, as well as for getting your underwear and pants on. And the sock aid, which you can use to get your socks or your TED hose on. As I said, these will be available for your use in your room. Please use them here to see if you like them or if you want them. I can use the reacher to push my shoes off, as well as to get my socks off. I can also use the reacher to get my pants on. When you're getting dressed, we recommend that you dress the operated leg first, as that leg does not move as well as your other leg. So once I get this leg in the hole, I can wiggle my other leg around however I need to. To use the reacher, when you pull the trigger here, it closes here. Get your waistband closed with the reacher. Get your foot through the hole. And once you can reach it with your hands comfortably, use your hands to pull it the rest of the way up. The other leg, you can just get in there the way you normally would. You can also use the reacher to get your pants off. After you've lowered your pants to knee level, you'll sit back down, use the reacher to get your clothes off so that you're not challenging your balance more than you need to as you're undressing. The sock aid is this. When you're using the sock aid, whether it's for the sock or for the TED hose, you'll get the bottom of the sock or the bottom of the hose at the bottom of the trough. And you want to get the toe as tight to this opening as you can get it. Smooth it out just to these knots. You'll hold one handle in each hand, drop this to the floor, put your foot in the hole, and once your foot is all the way to the end of that sock, you'll pull slowly, and as you reach your heel, angle it up the back side of your leg to get your sock on. When you're doing this with the TED hose, it works the exact same way. You'll put the hose on the trough, smooth it out as much as you can. One handle in each hand, drop it to the floor, slide your foot in, pull slowly, and at this point, you can reach down and smooth it the rest of the way. You will be wearing the TED hose until the doctor tells you otherwise. You generally only need to wear them during the daytime, and when you've had your hip done, they'll only be knee-high TED hose. You will need somebody to help you get these off. The other thing you'll notice when you're here in the hospital is we will be using these pads to cover your incision. We do not tape them to your skin. The undergarments that we spoke about in the beginning is what is going to hold this to your skin. So when you've had your hip done, we'll lay the pad over there, and when you pull up your underwear, the waistband will just hold that in place for you. You will be given some of these when you go home so that you can cover your incision when you're at home as well. Your incision will be getting wet and clean. We ask that you use a very gentle soap. Here in the hospital, we tend to use the Johnson & Johnson baby soap, and you'll be given some of that to go home with. But any gentle soap will be fine. Nothing with any skin sloughing capabilities, nothing with microbeads, none of those lotions or ones with built-in lotiony component, nothing that will get into your incision and cause an infection. Simple soap and water, dry it, and leave it alone. Nothing else will go anywhere on or near your skin where the incision is.